بسم الله الرحمن الرحيم، والصلاة والسلام على أشرف المرسلين سيدنا محمد نبي الأمي وعلى آله وصحبه وسلم. إخواني طلاب جامعة الدلتا، كلية طب أسنان جامعة الدلتا ليفل 2، نقدم لكم هذا العمل المتواضع إن شاء الله، وبإذن الله تعالى يبقى عمل ليكم في مذاكرة الأناتومي، بالذات الأناتومي بتاع اليد والنك. طبعا أنا بخص الذكر وأتوجه بالشكر لزمايلكم اللي قاموا بالتصوير والمونتاج بتاع الفيديو، محمد رشاد ومحمد برهان والدكتور عبد الرحمن إبراهيم. فلهم خالص التقدير والتحية للمجهود اللي بذلوه في إعداد هذا الفيديو. إن شاء الله الفيديو فيه النورما اوف ذا سكال، يعني هنشرح فيها النورما فيرتيكاليس وفرونتاليس واوكسيتاليس ولاتراليس وبيزاليس اكسترنا، بس ده عباره عن الجنرال فيتشرز بتاع البون، انما بالنسبه للبارتيكولار فيتشرز ان شاء الله يبقى في فيديو تاني باذن الله تعالى. شكرا.
بسم الله الرحمن الرحيم. We will describe the skull. We have the views of the skull are called norma. This is called norma verticalis. We will discuss bones, sutures, and features. This is the frontal bone, two parietal bones, and this is the occipital bone. About the sutures, we have here the coronal suture, this is the sagittal suture, and this is called lambdoid suture. Sometimes we have a suture here which is called interfrontal or metopic sutures. The third part is the features. We have here, number one, this is called bregma, which is the meeting point between the coronal suture and sagittal suture. This is the lambda, which is the meeting point between lambdoid suture and sagittal sutures. These two elevations are called parietal eminence. Sometimes we have here elevation which is called frontal eminence. This foramen is called parietal foramen. Parietal foramen. This area of sagittal suture, which is straight between the two parietal foramina, is called obilion. So this is the norma verticalis. Again, we have the frontal bone, two parietal bones, occipital bone. This is coronal suture, sagittal suture, lambdoid suture, bregma, parietal foramina, obilion, parietal eminence, and lastly we have lambda. Thank you.
The second norma is the norma frontalis. As we described before, we will talk about the bones, sutures, and features. This is the frontal bone, nasal bones. This is the maxilla, zygomatic bone. We have here many processes. This process is called frontal process of zygomatic bone. This one is called zygomatic process of frontal bone. This is the bones. We have the sutures. This suture is called internasal suture, intermaxillary suture, zygomatico-maxillary suture, frontozygomatic, frontomaxillary suture, frontonasal, and this is also frontomaxillary sutures. These are the sutures of norma frontalis. We have here features. Number one, the first of all, we'll describe the major opening. This opening is called orbit, which contains the eye, anterior nasal opening or aperture. This is called mouth opening. So we have orbit, anterior nasal opening, and the mouth. Regarding the features, we have here what's called superciliary arch. Superciliary arch. This part is called glabella. The meeting point between the internasal and frontonasal suture is called nasion. Nasion. This is called anterior nasal spine. Anterior nasal spine. Incisive fossa, canine eminence,
canine fossa, incisive fossa, canine eminence, canine fossa. In the upper border of the orbit we have here what's called supraorbital notch. Supraorbital notch. Infraorbital foramen. Infraorbital foramen. This small foramen here is called zygomaticofacial foramen. Zygomaticofacial foramen. We will revise it again. The bones, frontal bone, nasal bone, zygomatic bone, maxilla, the opening, orbit, anterior nasal opening and mouth opening. Regarding the minor opening, we have here supraorbital notch, infraorbital foramen, and the mandible here we have mental foramen. They are in one vertical direction, like this. Supraorbital, infraorbital foramen, and mental foramen. The features we have superciliary arch, glabella, nasion, anterior nasal spine, incisive fossa, canine eminence, and canine fossa. Thank you. The third norma is the norma occipitalis. As we said before, we will describe bones, sutures, and features. These are the bones. Number one, which is called parietal bone. This is the occipital bone. And this is mastoid process, which is a mastoid part of temporal bone. About the sutures, we have the posterior part of sagittal suture. This one is called lambdoid suture. The small suture that separates the mastoid process from the occipital bone is called occipitomastoid suture. About the features we have here, lambda. This point is called asterion. Small elevation called external occipital protuberance. Its summit is called inion. This line is called superior nuchal line. External occipital crest. Inferior nuchal line. Above the superior nuchal line we have imaginary one which is called highest nuchal line. This foramina is called mastoid foramina. If we proceed like this, we'll find this foramen magnum. These are the occipital condyles. Mastoid notch or digastric notch. This is groove for occipital artery. So again, if we preview this, this is lambda, external occipital protuberance, external occipital crest, superior nuchal line, highest nuchal line, inferior nuchal line, mastoid process, mastoid foramina, mastoid notch, groove for occipital artery. This suture is called occipitomastoid, brachiomastoid suture, lambdoid, and the meeting point is called asterion. That's all. The fourth one is norma lateralis. We will describe bones, sutures, and features. About the bones, we have number one, which is called frontal bone, 2, parietal bone, 3, occipital, 4, this bone is called temporal bone. This part is called squamous part of temporal bone, and this is called mastoid process or mastoid part of temporal bone. This small bone is called greater wing of sphenoid. Greater wing of sphenoid. Zygomatic bone, maxilla, and this is the mandible. This process is called zygomatic process of temporal bone. Small process called temporal process of zygomatic bone. Frontal process of zygomatic process of frontal bone. These are the bones that forms norma lateralis. About the sutures, we have the coronal suture, mastoid, occipitomastoid, lambdoid suture, zygomaticotemporal suture, fronto-zygomatic suture. This H-shape suture, which is the meeting point between frontal bone, parietal, squamous part of temporal, and greater wing of sphenoid, is called pterion. The meeting point between the parieto-mastoid, occipitomastoid, and lambdoid is called asterion. About the features, here we have foramen called zygomaticofacial foramen. Zygomaticofacial foramen. This process is called, the two processes are united with each other to form the zygomatic arch. Zygomatic arch. We have here two lines. One is called superior temporal line, and the other one is called inferior temporal line. If we proceed like this, we will find what's called supramastoid crest. Supramastoid crest. Then this is the zygomatic arch. So this area is called temporal fossa. Temporal fossa. This opening is called external acoustic or auditory meatus. This is a mastoid process. We have mastoid foramina here. This is the zygomatic arch. We have a small elevation called mandibular tubercle or articular tubercle or mandibular eminence or tubercle of zygoma. This is the supramastoid crest. Here we have a small triangular area called suprameatal triangle. Suprameatal triangle. Again, this is the frontal bone, parietal, occipital, mastoid process, squamous part of temporal, greater wing of sphenoid, zygomatic bone, mandible, maxilla, fronto-zygomatic suture, zygomaticotemporal suture, pterion, asterion, two temporal lines, supramastoid crest, suprameatal triangle, external auditory meatus, mandibular or articular tubercle, zygomaticofacial foramen. Now we are going to describe the mandible. As we all know, the mandible consists of, this is called ramus, two rami, and this part is called body. The two rami, each one has two processes. This is called coronoid process, and this one is called condyloid process. The two processes are separated from each other by mandibular notch. We will have more details about the coronoid process. This bulging part is called head, constricted part called neck, and small depression in front of the head which is called pterygoid fovea. The junction between the body and ramus, we have here the angle of the mandible. If we proceed to the body, we have this is called mental foramina. Mental foramina. This part which carries a socket of teeth is called alveolar process of the mandible. The junction between the two parts of the mandible is called, or two halves of the mandible is called symphysis mentae. This triangular elevated area is called mental protuberance. Two tubercles which are called mental tubercles. If we look to the inner surface of the mandible, we have this is the mandibular foramen. Small projection is called lingula, mylohyoid groove, and this is mylohyoid ridge. The mylohyoid ridge divides the inner surface or the lingual surface of the mandible into sublingual fossa and submandibular fossa. Here we have small projections, about 4 in number. They are called genial tubercles or mental spines. These small depressions are called digastric fossa. So again, this is the coronoid process, condyloid process, mandibular notch, head, fovea, neck, angle, alveolar process, mental foramen, mental tubercle, mental protuberance, symphysis mentae. In the inner surface we have the mandibular foramen, lingula, mylohyoid groove, mylohyoid ridge, sublingual fossa, submandibular fossa, genial tubercles, digastric fossa. Thank you. Bismillah ar-Rahman ar-Rahim. Today we are going to describe the norma bissalis externa. We will divide it into this smaller anterior part which forms the palate. This is the alveolar process of maxilla, alveolar process of maxilla or alveolar arch, palatine process of maxilla. This bone is called horizontal plate of palatine bone. The features which are present here, we have here anteriorly, we have incisive fossa. If we look inside it, we will find what's called incisive foramina. This foramen is called greater palatine foramen, greater palatine foramen. Smaller one called lesser palatine foramen. This small bony elevation is called palatine crest, palatine crest. Lastly, we have the posterior nasal spine. So this is the hard palate again, alveolar process of maxilla, palatine process of maxilla, horizontal plate of palatine bone, incisive fossa, greater palatine foramen, lesser palatine foramen. Here we have what's called palatine groove, palatine groove. This is the posterior nasal spine. This small bone that shares in the formation of the nasal spine is called vomer. Posterior nasal opening or posterior nasal aperture. These two processes is called pterygoid process. Pterygoid process, which is a part of sphenoid bone. It consists of lateral pterygoid plate, lateral pterygoid plate. This is another one, which is called lateral pterygoid plate, medial pterygoid plate, medial pterygoid plate. The small depression in between is called pterygoid fossa. This is the medial pterygoid plate, and this is the other medial pterygoid plate. We have small bony projection here called pterygoid hamulus. Pterygoid hamulus. This is the pterygoid hamulus. Here we have a small fossa which is called scaphoid fossa. Scaphoid fossa. If we proceed in the middle line like this smaller part is called basilar part of sphenoid or basisphenoid. This part is called basilar part of occipital bone. Basilar part of occipital bone, condylar part of occipital bone, squamous part of occipital bone. In the basilar part of occipital bone, we have here small bony projection called pharyngeal tubercle. Pharyngeal tubercle. If we proceed posteriorly, we will find the foramen magnum. Foramen magnum. On each side we have the occipital condyles. Occipital condyle. We have just a small foramina is called anterior condylar canal or hypoglossal canal. Anterior condylar canal or hypoglossal canal. Small depression behind the occipital condyle, which is called posterior condylar fossa or canal. It may be closed or open. This is a squamous part of occipital bone. We described it previously in norma occipitalis. This is the external occipital protuberance, superior nuchal line, external occipital crest, inferior nuchal line. We have here highest nuchal line. This suture is called occipito-mastoid suture. Occipito-mastoid suture. We'll proceed in this direction like this. Like the direction of my fingers. We have mastoid process. Mastoid process. Stylomastoid foramen. Styloid process. Jagular foramen. Jagular foramen. This is rounded opening, is called carotid opening. Carotid opening. Quadrate area present in the petrous part of temporal bone. Foramen lacerum. So we have again mastoid process, stylomastoid foramen, styloid process, jagular, carotid, quadrate, lacerum. This is a mastoid process we have here. And this one, this is called mastoid notch or digastric notch. And this small groove is groove for occipital artery. Groove for occipital artery. This bone is called zygomatic arch. Zygomatic arch. That divides into anterior root and posterior root. The small depression in between is called mandibular fossa. Mandibular fossa. This elevation is called mandibular tubercle or articular tubercle. We have a small fissure in the bottom or in the top, of the mandibular fossa, which is called squamotympanic fissure. This bone is called the greater wing of sphenoid. If we proceed like this, we will find infratemporal crest. Infratemporal crest. This surface is called infratemporal surface of greater wing of sphenoid. This foramen is characteristic and called foramen ovale. Foramen ovale. Behind it we'll find foramen spinosum, and this is the spine of sphenoid. Spine of sphenoid. Thank you.